Hi friends, and welcome back to the 802 United for Saturday Story Time. I'm going to talk about a topic I added to the end of a video recently, and I realized nobody's still watching my videos after that long. So today we're going to talk about Misoprostol. The brand name is Cytotec. We use it every day on labor and delivery in obstetrics. But did you know Misoprostol, which is now considered a controlled substance in Alabama since this summer, thanks guys, was originally used to heal and treat stomach ulcers, which happened to people who took NSAIDs like ibuprofen or anaprox or naproxen or Advil for long-term for arthritis. But it's a prostaglandin analog, which means it acts like prostaglandin, a hormone that's important for softening and ripening the cervix and getting it ready when you have a person who is ready for full-term labor and their baby doesn't get the idea that it's time to labor. So this mom's going overdue, and we need to do something to get that cervix ready to make her labor easier and shorter. Now, can it also be used in situations in early pregnancy where that little tiny embryo no longer has the DNA messaging to tell it what it should be doing, and it stops growing, and that little flicker that's going to be a heart stops beating? That's a great place to use Misoprostol, to use Cytotec, because otherwise that patient can wait for weeks and maybe she's bleeding that entire time. We can also use it in stillbirth that's farther along, when there's no survival here. The pregnancy has already passed away, but the uterus doesn't know it's time to labor now. So we can use higher doses of Misoprostol to get that labor going. Most importantly, Misoprostol saves lives. Since Alabama has made this a controlled substance, that means that if there is a patient who has delivered and they're bleeding on the floor, and I have personally heard this sound, not only for my patients, for me personally, I was hemorrhaging after my first birth. And instead of reaching onto a hemorrhage cart right there in the room, popping that medication in this person's mouth and getting them treated, no, now someone has to go down the hall to a locked room, turn a key, use their fingerprint, put in a code, whatever. They get this medication out. If their hands are shaking because they're scared because this person's trying to die, maybe that takes even longer. They finally get this medication and they come back to the room, and meanwhile time is lost and blood is lost and people will die. There is absolutely no reason for this to be a controlled substance like cocaine, which, believe it or not, has medical uses. It's ridiculous, and it is misogynist. It is hateful toward women. It means these people in Alabama in the legislature think they know more than the doctors do. Please let me save your friend, neighbor, family member, child. Please let me save their life with Misoprostol. Remember, stay informed and be kind, always.